the debate on this matter will now proceed.
Alberta's 4 opposition parties were granted an emergency debate in the legislature regarding the opioids crisis. The number of people dying across the province has skyrocketed over the last 4 years. Local Dr. Bill Rizicki says declaring a state of emergency is the right thing to do.
Fentanyl and the latest drug, carfentanil, which is even more dangerous, is out there, and we don't want any of our people to die needlessly.
The opposition party says declaring a state of emergency would increase coordination, expanded powers, and maybe even provide federal funding like British Columbia has received.
It's a problem throughout Alberta, and it is not a problem to be taken lightly.
But the NDP isn't budging, saying declaring an emergency is not necessary.
There's nothing that declaring a public health emergency gets us that we don't already have access to.
Payne says naloxone kits have been distributed to doctors, and the federal government has issued $65 million to deal with the problem. But Barnes says sometimes money is not enough.
Throwing money at a problem is not the only solution or the best solution. Information sharing, an awareness campaign that taught all Albertans the dangers of this.
And the numbers show the dangers of the growing problem. In 2011, there were 6 deaths in Alberta. 5 years later, 343 people died. That's nearly 1 death every day. Here in Medicine Hat, police say 9 have died from opioid-related overdoses in the last 2 years. Rizicki says something needs to be done to combat the highly addictive drugs.
Patients, they don't have the experience in dealing with the medication, so they sometimes want complete relief from pain. That's where the misuse can start.
The opposition parties say a state of emergency will help the lack of education in the healthcare system on this issue. And Rizicki agrees, but says the problem also falls on doctors and how they prescribe the deadly opioids. Stephanie Villella, Chat News.